Okay, picture this. You're out with your dog. They're having the time of their life, maybe chasing a ball, just pure zoomies.
Yeah,
Yep,
yeah, that happy blur.
exactly. And then, boom, their legs just buckle. They're down,
Yeah.
but they're looking right at you, awake. Maybe you'd be confused, but totally there.
It's definitely startling when you see it.
It really is. And that's kind of a snapshot of canine narcolepsy and cataplexy, which is what we're diving into today.
Okay.
We've got some really good information here from a veterinary source.
Mm-hmm.
And the mission basically is to unpack this. What is it? What causes it? How do vets figure it out? And importantly, what can be done? We're going to hit the key stuff, the things you'd really want to know.
Sounds good. And it's interesting because you hear narcolepsy and cataplexy, and while they're linked in dogs, it's often the cataplexy that owners notice first.
Right. So narcolepsy itself, that's the sleep disorder side.
Yeah.
Like excessive sleepiness.
Yeah, exactly. In humans, it's that overwhelming urge to sleep, sometimes sleep paralysis, even hallucinations as you're drifting off. Dogs can have some of that too, the sleepiness, but the really dramatic part is usually the cataplexy.
Okay, so cataplexy, let's focus on that. That's the sudden loss of muscle control, but temporary.
Temporary is the key word. Sudden, temporary muscle weakness, or even like full paralysis. But, and this is crucial, the dog is completely conscious.
Not like fainting or a seizure then. They know what's happening.
Right, they can still track you with their eyes, hear you. It's like the off switch for the muscles gets flipped briefly.
Huh. And why does that happen? Like, what's going on physically?
Well, the theory is it involves an inhibition of the motor neurons in the spinal cord. Basically, the go signals from the brain to the muscles get blocked for a moment.
So the command is sent, but it doesn't arrive.
Pretty much. And yeah, while the dog might be sleepier overall or have weird sleep patterns, it's these sudden collapses, the cataplexy, that usually sends owners to the vet, understandably.
Makes sense. So who gets this? Is it any dog?
Primarily dogs, yeah. It's very rare in cats. And there's definitely a big genetic piece in some breeds.
Okay, which breeds are we talking about?
We know for sure about Labrador retrievers, Dachshunds, and Doberman pinschers. There's a specific gene identified.
Oh, really? They pinpointed it.
Yeah, it's called the Canark1 gene. It's on chromosome 12, and it affects how the body uses a brain chemical called hypocretin. You might also hear it called orexin.
Hypocretin. Okay, that rings a bell. It's involved in sleep and wakefulness, right?
Spot on. Think of it as a key player in keeping you awake and alert, and also in stopping that muscle paralysis of REM sleep from happening when you should be awake.
So in these dogs, that system is faulty somehow.
Exactly. The receptor for hypocretin doesn't work quite right because of that gene mutation. And interestingly, in Dobermans, they've also seen some signs pointing towards the immune system being involved, like more certain immune cells in the brain.
So
Yeah.
it could be complex. What are other breeds?
Well, it's strongly suspected in miniature poodles, too, even though they haven't nailed down the exact inheritance pattern yet.
Gotcha. So if you have one of those breeds, especially Lab, Doxy, Doberman, this is something to maybe keep in the back of your mind. When does it usually show up?
If it's the inherited kind, it typically starts young, often between, say, 2 and 4 months old.
Wow, really young.
Yeah. And the episodes might get a bit worse or more frequent around maybe a year old. But here's a strange thing.
Like that.
The information suggests that sometimes the signs can actually get better or even disappear as the dog gets older.
Get out so they could just grow out of it. How?
That's the million-dollar question, isn't it? The why isn't totally clear. Maybe the brain finds ways to compensate over time. Other pathways step up. It's still being researched.
Fascinating. But that's just the inherited form, right? You said there's another type?
Right. There's also an acquired form. This can pop up in older dogs, any breed, mixed breeds too, really at any age.
And what causes that?
The thinking there is it might be related to the brain actually producing less hypocretin, specifically in the hypothalamus. And unlike the inherited form, if it's acquired, the signs usually stick around for life.
Okay, so 2 roads. Genetic in young specific breeds, potentially improving, or acquired later in life, any breed, usually persistent. Makes sense. So what else might you see besides the collapse?
Well, between episodes, the dog is typically completely normal. Vet check, neuro exam, all clear.
Right.
It's only during an episode things look off. And it starts very suddenly paracute, is the term vets use. And like we said, while maybe there's some extra daytime sleepiness, it's the cataplexy owners report.
Can you describe an episode again? Like, what does it look like? How long does it last?
Sure. So sudden limpness, flaccid paralysis, but conscious. It can be super short, just seconds, Or it might last, several minutes, maybe even up to 20 minutes in some cases.
20 minutes. That must feel like forever.
Oh, I'm sure it does for the owner. But then usually they snap right back to normal just as quickly as it started, and they might have several episodes in one day.
And during the episode itself, are there other little signs? Something about sleep.
Yes, because it's basically REM sleep paralysis happening at the wrong time, you might see things typical of REM sleep, like their eyes might move rapidly under the lids, maybe some muscle twitching, facial twitches, sometimes even little whimpers or whines.
Like you're dreaming while awake and paralyzed.
Kind of, yeah. But importantly, they can usually still be aroused. Like a loud noise or petting them can often bring them out of it.
Okay, that's good to know. So you can interact with them. We talked about genetics, but what else triggers these? You mentioned excitement.
Right. We've got the genetics, possibly the immune system in some acquired cases. But down at the chemical level, it seems to be about imbalances in neurotransmitters. Serotonin, dopamine, norepinephrine, and especially hypocretin or orexin.
Those brain messengers.
Exactly. And very rarely it's been linked to some kind of damage in the brainstem, the pontomedullary area. But mostly, the triggers are common things like intense excitement, as we said, strong emotions, good or bad. Feeding time is a big one.
Just eating?
Yeah, the anticipation and active eating. And even general anesthesia can trigger it, which is really important for vets to know.
Wow. So the happiness of seeing you or just dinner time could cause a collapse.
It seems so. These things likely cause shifts in those brain chemicals, tipping the balance into that waking REM paralysis state.
Okay. This sounds like it could be tricky to diagnose then.
Yeah.
How do vets confirm it's narcolepsy cataplexy and not something else?
Yeah, diagnosis is often about ruling other things out first, the differential diagnosis. Things that might look similar on the surface.
Like what? Fainting?
Syncope, yeah, fainting is one. Seizures are another big one to rule out.
Yeah.
But with cataplexy, you usually don't get the peeing or pooping or the really rigid muscles you might see with a seizure.
And the recovery is faster.
Much faster, usually immediate, unlike that post-seizure confusion. Then you've got things like non-convulsive seizures, sometimes called drop attacks, or other neuromuscular problems.
But those usually come on differently.
Generally, yeah, neuromuscular issues often aren't quite so sudden on, sudden off. So standard blood work, urine tests, they usually come back normal.
Doesn't point you directly to it then. What else?
Well, for those specific breeds, labs, dachshunds, Dobermans, you can do a DNA test now that's pretty definitive if it comes back positive for the mutation.
Oh, okay. That's useful.
Very. You can also test the cerebrospinal fluid, the CSF. It's often normal, but sometimes might show low levels of a hypocretin byproduct, or orexin A.
And I saw something about food tests and play tests.
Yes, those are clever.
Yeah.
They're designed to try and deliberately trigger an episode in a controlled setting.
How does the food one work?
You basically offer the dog a sequence of really tasty food items and watch closely. You time how long it takes them to eat, and you count if they have any cataplectic attacks while eating.
And infected dogs will.
They might take way longer to eat and have multiple little collapses or moments of weakness during the process, whereas a normal dog just gobbles it down.
And the play test is similar, but with excitement.
Exactly. Get two dogs playing, see if the excitement triggers an episode in the suspected dog. It mimics those real-world triggers.
Neat. And there was one more test mentioned. Physostigmine. Sounds serious.
It's a bit more involved. Physostigmine is a drug that affects neurotransmitters. In some narcoleptic dogs, giving a small IV dose can actually induce cataplexy, especially if you follow it up with that food test again.
So it makes them more susceptible for a short time.
Kind of, yeah. It can help confirm the diagnosis. But interestingly, brain scans, like MRIs, are usually normal. It's more about brain function than structure.
So seeing an episode is still pretty key.
Absolutely. Observing it or provoking it with these tests is often the most crucial diagnostic step.
Okay, so let's say you get the diagnosis. What can you do? How do you manage it?
The main goal is just to reduce how often the episodes happen and how severe they are. And the first thing to reassure owners about is that cataplexy itself isn't fatal.
That's huge, because it looks terrifying.
It really does. But they don't choke, they're not suffering during the episode. That said, you do have to think about safety.
Right, like activities where collapsing would be dangerous.
Exactly. Swimming is a big one. Hunting dogs, off-leash exercise near hazards. You need to be really careful because they could collapse at any moment.
That makes total sense. Constant vigilance needed.
Definitely. Now, if the episodes aren't happening very often and the dog seems fine otherwise, sometimes the vet might say, let's hold off on meds for now.
And just manage the triggers.
Yeah, focus on avoiding known triggers. quieter greetings, maybe changing feeding routines to be less frantic. But if the episodes are frequent or really impacting life, then medication is usually the way to go.
Okay. What kind of medications help?
There are a few options. Imipramin is one, often given a few times a day. Methylphenidate, maybe once or twice daily. Selegiline is another, usually once a day. Yohimbane as well.
So several choices.
Yeah, and sometimes vets will use combinations of these drugs to get better control.
Are there side effects to worry about?
There can be, yeah. Like increased heart rate, faster breathing, maybe loss of appetite, some tremors. Overheating during exercise can be a risk with some of them, and sometimes dogs can build up a tolerance.
Meaning the drugs stops working as well.
Right, so you might need to adjust the dose or switch medications over time. It means regular vet checkups are really important.
So it's not necessarily a set it and forget it's treatment.
Yeah,
It's ongoing management.
very much so. What's the outlook generally?
Well, sometimes just managing those triggers really well can reduce the need for medication. And remember, the inherited form might improve with age.
Oh, right.
But, you have to be realistic. Even with treatment, the results can vary a lot. Some dogs will still have episodes.
So manage expectations.
Definitely. But the big takeaway is, while it looks scary, it's often manageable. Understanding those triggers, the signs, working closely with your vet, that's key.
Absolutely. And, thinking bigger picture, this whole connection between hypocretin emotions triggering muscle paralysis, it really makes you wonder, doesn't it?
About what?
About the deep links between sleep, emotion, and motor control. Not just in dogs, but, well, in all of us. What else is going on there? How interconnected are these systems, really?
Huh. Yeah, it makes you think about how finely tuned everything has to be and what happens when one little chemical signal goes slightly wrong.
Exactly. It's a fascinating little window into how complex brain function really is.